The time having arrived and a quorum of members present, I'll call the Public Health and Safety Committee for Monday, August 19th, 2024 to order. We have 4 members present. Alder McElhaney is excused for all meetings this evening. Item number 1 is to consider approval or denial of various license applications. We have 1 application recommended for denial, bartender license for Heather Vince. That recommendation was the only one recommended for denial under our ordinance. She would have the right to address the committee if she so chooses to review the record. Is Heather Vince with us this evening? Heather Vince? Okay, let the record show she has not appeared to address the committee about the denial. Along with that, you'll see a number of events all recommended for approval with the batch, and then some renewals. So with that, I would take a motion to accept or deny licenses as recommended by staff.
I also make the motion,
We have a
Madam Chair.
motion from Larson. Is there a second? Second by Lukens. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed, so that item carries with a batch of approvals and 1 denial. Item number 2 is the Tavern Activities Report from July 1st to July 31st, 2024. Anything notable on the report that you wanted to discuss with us, Chief?
Nothing specifically notable. Some feedback. Are we closer to meeting your expectations and what you'd like to see with this report?
I actually got some right after the packet came out saying that the report was much better in terms of detail, and it was exactly what it was missing before. So I think we've hit the nail on the head where we've picked out the notable events, and we've given just enough detail that the public can understand what is happening out in the field. So I did get positive feedback about that yesterday.
Thank you.
So anything on the report that you guys would like to talk with the chief about that you've noticed? If not, we'll place their report on file. And item number 3 on our agenda is the community outreach update. So we'll invite our outreach coordinator, Tracy Rieger, up to give us an update. Welcome.
Hello, thank you. I just want to point out a few things on my report. The numbers are a little bit lower this month, partly because Bridge Street Mission did not do any new admissions during their move. So they did move all of their men into the new space on July 22nd, and they already brought 3 new gentlemen in since they've been there. So they also did report that the renovations are started on their outreach center. So that was a great report to get. Also, in the Good Shepherd Daily Census, you notice there was a spike on the 24th. That was the point in time count. So they did extend their beds and open up the 10 additional for those that were found out in the community that wanted shelter for that evening. In terms of the point in time count data, I did reach out to Diane Senholtz, and she was able to share with me that 11 people were found unsheltered that evening. So that number's a little bit lower than what we saw last summer, I think. So I think we're moving the needle. We're finding places for people to go and getting them housed. With that, I will say that I did meet with a fair amount of people last month, and 4 of those people were housed. One of those, actually it was 5 people because one of them was a mom and a teenage daughter. So I think the thing to report most, though, this past month is that I did apply for an impact grant through the United Way. $10,000 is what I requested. I was awarded about half of that. And the objective of that money was to help with security deposits, as our unhoused individuals were getting Section 8 vouchers through our housing authority. We were finding that not only were they having barriers to finding landlords that would rent to them because of their criminal histories and their eviction histories, but the landlords were also extending a double, sometimes triple security deposit. So I'm happy to report that in the month of July, I was able to help 3 of those individuals with vouchers get housing, and already 2 the month of August, and I've already spent through all but $365 of that grant money. So I'll be reporting that out to the United Way and hopefully reapplying for some additional funds to continue to help.
Perfect. Anybody have questions at all about the report or about our current status?
Do
Go ahead.
You sent me some emails today, Tracy, with
Yep.
some information about how many repeat guests at Good Shepherd and then how many new, never before seen individuals. I think that's relevant for this group.
Sure, thank you for reminding me of that. Yeah, so every month when I get data from the Good Shepherd Shelter, they also do like a compacted data section for me. So what I want to report here tonight, I think, is pretty significant in terms of the amount of people that are being seen. So January 24 through June of 24, there were 153 unduplicated guests that stayed at the Good Shepherd Shelter. Of that, 78 were brand new, never been in our homeless shelter system before. 7 of those were new guests to Good Shepherd Shelter. They had spent at least one night at the Salvation Army prior to them changing their model. And 56 of the people that reported in that 6-month time frame were repeat customers to the shelter system. So, you know, the numbers are still pretty high and pretty significant. And I think that's worth sharing here.
For sure, for sure.
So
go ahead.
just an observation, you know, we still struggle, we get asked, how many unhoused people are in Wausau? And the best piece of data we get to try and analyze, like, are we functional zero? Are we growing? Are we not? Is this data from the warming center? We don't necessarily interact with everyone, and to be able to track that and balance against each other. So, like, that seems like the relevant statistic, at least when I'm speaking to groups or people and they're like, where are we at? Instead of making an observation about it, I'm just like, here's a piece of data, and that generally seems to help them wrap their head around the issues we're dealing with. If there's some other piece of data you guys would like to help measure that, or an idea you have, I think we're very open to that.
I think it's helpful to have that information, you know, as we review, because then we can tell, you know, kind of in real time if we're seeing numbers up or down, you know, and then there may be contributing factors to those spikes or, you know, peaks and valleys. So I do think it's helpful to know that, you know, and have those numbers. I guess committee members, anything that you have questions on or that you're thinking about as you get these numbers? And I think, otherwise, I think we're good to place this report on file. So, I mean, I do believe that we're moving the needle. I think that even though for, you know, all of the people we have been able to help since Tracy began, obviously other people have replaced them that also need help. But the fact that there is help in the first place here, I recently read an article, kind of a recap in our local media, one of our media sources, that talked about, you know, what we had discussed in our committee the whole last month about this subject, and said that it's important to recognize that all of the efforts that we've undertaken did not exist here 10 years ago. And I think that really is something that we have a right to be proud of. I think the fact that there is help and that it is a system of functioning services that people can access and get assistance from and know that they're there and have someone guide them to get through that process. Where in the past, for the services we did have that did exist, it was very difficult to know first what they were and where they were, and then how to get in, like how to get into that. And I think to have that coordination and collaboration both between agencies, and then to have just a compass that can help people navigate those services is a huge blessing for our community. Sarah?
I think it was after the cow. I was sort of thinking about that homeless management information system, and I asked you about it. Like, how do we leverage that? Is that something that we, you know, to really get more accurate numbers and information?
So it's a little bit difficult. It's kind of like if you've heard us talk about case conferencing. So there are specific confidentialities, if you will. The people that have the HMIS access, which I did have access to that at one point, it's monitored by a company who is really tight on their data. So they don't want to share data amongst a lot of different nonprofits that are in our community. And so where it gets really tough is that they hold me to the same standard that they hold all the nonprofits to. So all of the monitoring that they do, and even though my program is very different than a lot of the services in our community, they hold me to the same standard of making sure that I'm compliant like the others. And it's just been really difficult to work with them. I mean, I think we could get access again, but they have not made it very easy to gain that access, so.
Helpful, though, among the agencies, we just talked about this last month, or at our, or actually early August, we talked about it at our Housing Task Force that United Way is operating. And, we all in that group have been very, very interested in getting case conferencing off the ground. They've been able to do a version of case conferencing where there is confidentiality because you can conference about cases as long as there's no references to individual data points, identifying factors. If they have those discussions in a general way among agencies that all can provide help. With the United Way in the middle as a facilitator, that has at least started to break the ice on getting agencies talking to each other who have help they can give to individual people without referring to them by name. And so that then has helped a lot with, some of the agencies were afraid to participate based on the confidentiality requirements, that they were afraid their grant funding would be jeopardized if that information was too specifically shared.
Right, and I do want to
So-
also confirm that those that are entering the shelter system or those that are getting help through CAP services, there is paperwork that the balance of state makes them complete with these individuals. And if they sign a release of information for CAP services or Catholic Charities to talk to other service providers in the community regarding housing, they're allowed to do that. So I am consistently sharing information and helping and collaborating with all of our partner agencies and individuals that I'm finding out in the community that are unhoused, or if they're looking for a specific person that's unhoused and they can't seem to locate them, they'll contact me. So we really are working together. It's just not in a big room with a ton of people.
Right,
I
right.
think just a couple of observations on that. The one thing that's disappointing about this community through my lens is we are aware of other communities throughout the United States that all have the same funding sources for serving this population. And they are successful at case conferencing and being able to say, how can we help Matt Barnes? And here are his issues, and getting all the right players. And they do that with a release, and the different players all accept the release. When a frustration from law enforcement, the analogy I can provide is we're all familiar with HIPAA, right? Every time you go to the doctor, they give you a HIPAA notice. And we might, in the course of a case, deal with a medical provider, and they'll say, we can't give that to you, it's HIPAA. And we know that it's not. But there's no consequence for an organization if they don't provide information that they were able to, but there is a significant consequence if they provide information that they were not able to. So the easiest way to stay out of trouble with funding sources or with the government is to be more restrictive, and unfortunately, I think that impacts the quality of services we're able to provide.
Yeah.
It does. And I think that, if we continue conversations with those agencies and those directors and, keep it general, at least the fact that we've got something in play now that's kind of starting to work, hopefully they will recognize and build some confidence with that and be willing to at least try to participate and recognize that, they can safely do that and maybe even make a bigger impact as an agency than they could going it alone. So, Sarah.
And I did reach out to one of the communities that hit that functional zero, and that was one of the reasons that database came up, because it is about like sharing.
Yeah.
And so this was, I have a presentation and I could forward it for our next packet for when we talk about this, but it's in Rockford, Illinois, and they have the functional zero. So
Okay.
maybe there's something we can work with to get back that database, because sharing is sort of how you fix those problems.
The task
But-
force has agreed, too, that
Yeah.
its goal is also functional zero. They're going through a results-based accountability workshop series now to figure out what next for that group, because their to-do list has been largely completed over the last 3 years. So once they get through that and figure out what their what next looks like and what the composition of the group looks like, too, we'll have that group to rely on also for ongoing conversations about the same thing. So, and the chief, the mayor, Tracy, and I all sit on that group. So we're in those discussions every month. So anything else anyone has on the report? If not, we'll place that report on file. Thank you so much for everything,
Welcome.
Tracy. That is our last agenda item. We kept it light this month on purpose because we have a council meeting coming in a few minutes here, so I'll take a motion to adjourn.
Move to adjourn.
Motion from Watson, is there a second? Second by Lukens.
Aye.
Aye.
Members in favor signify by saying aye. Aye.
Aye.
Opposed? No one's ever opposed. So we'll stand adjourned then. We'll make way for common council in this chamber in a few minutes, and then we will, at 6 o'clock, and then we also have committee of the whole tonight to secure a volume of public comment about the potential for a mandatory lead service line ordinance that was deferred action by council last month. So we'll stay tuned for that as well. With that, we will see everyone in a half hour. Thank you. It says 6 on the agenda. 6.